Well, I want to thank everybody for joining us today at the Cancer Center Symposium. And it is my distinct pleasure and honor to introduce Christy Cahill, who is currently the Executive Director of the Colorado Cancer Coalition. She got her degree in kinesiology at Rice University, and she has dedicated her entire career to all cancer-related causes, from cancer prevention, early detection, to ensuring that cancer patients and their caregivers have access and have quality cancer treatment and care. So without further ado, Christy, we have asked you to do a presentation on the Colorado Cancer Coalition and the cancer plan. Christy is also a member, I must say, Christy is also a member of our Cancer Center Community Advisory Council, and we have worked closely with her in aligning our priorities with the cancer plan, as well as taking her input not only on those priorities, but also on the activities to reach those priorities. And we have several initiatives in common. So without further ado.
To the speaker at the podium, we need you to turn on your microphone. There's a button at the base of the microphone.
Thank you. I've been involved with the Colorado Cancer Coalition since 2009 in a variety of capacities, and I've been the executive director for the past 3 years. And so today I just really want to share how you can get involved with the statewide coalition and help improve the quality of life for cancer patients all across the state and help prevent cancer as well. So we're going to walk through some of the history and the rationale behind the cancer plan. I'll show a few goals and objectives in the cancer plan, as well as some data that helps us prioritize where we focus our efforts. And then I'll also share some ways that you can get involved through task forces and through other work happening across the state, so that we can all work together to improve the lives of Coloradans. So in a state where 22 people die a day from cancer, and in a state where cancer is the leading cause of death, how do we work together to prevent cancer, find it early, treat it better, and improve the quality of life for survivors? And my answer to that is through the Colorado Cancer Coalition. So we have two distinct audiences. The first is those who work in any sort of cancer-related field. We provide this neutral playing ground for them to come together. We provide education, networking, best practice sharing, and partnership opportunities, so that nobody's out there reinventing the wheel, and we're all learning from each other. And then additionally, we also have resources available for patients and caregivers, so that they can find local Colorado resources, places close to them where they can get screened, where they can find a genetic counselor, where they can find cancer support groups and things like that. This is our mission: to engage, facilitate, expand, and strengthen the statewide network dedicated to improving Colorado lives touched by cancer. And then overall, our vision is to eliminate the cancer burden in Colorado. So we really see ourselves as a capacity builder, a convener, and a connector. So if there's a research project going on, we want to help spread the word about that research project and get more patients to it. If there is presentations happening that everyone could benefit from, we want to spread the word about those presentations and just enhance things that are going on, help fill gaps across the state. So that's it: capacity builder, convener, and connector for anybody working in the cancer space. And our work is really guided by the cancer plan. So every state has a cancer plan. There's actually 63 cancer plans across the nation. And we're on our 5th iteration of a cancer plan here in Colorado. It's a CDC priority. It's evidence-based. Over 100 subject matter experts come together to help prioritize what's in the cancer plan and what that roadmap for what Colorado should be focusing on, what that looks like. And each goal has strategies and objectives to help share those evidence-based practices that could help move the needle. Skip that one. So our plan, it has 9 goals all across the continuum of cancer care. So it starts with tobacco cessation and healthy behaviors. It moves on to family history and immunizations and things that can help prevent cancer. There's some environmental exposures. Then it moves on to screening and early detection and clinical trial access. And then there's a whole chapter on survivorship. And then lastly, the last chapter is about patient engagement and health literacy and growing the navigation workforce so that patients can get the care they need when they need it. So I'll go through each one of these in detail, but like to just give this snapshot. So goal 1 is to decrease tobacco use among youth and adults. And it has 4 objectives, talking about reducing initiation and use of tobacco products, decreasing exposure to secondhand smoke and electronic cigarettes, and promoting quitting and increased successful quit attempts. And there are a few data sources out there that help guide this work. So hopefully you guys will learn a few new data sources today that you can use in your research. There's the vision tool.
We're not seeing the slides. Can you hear us? This is James. Sorry. We're not seeing the slides. I don't think you're sharing your screen unless it's just me. I don't think anyone online can see the slides.
Okay. Yeah, they're being shared.
Now we can. Thank you.
Thank you. I'm sorry. And then,
Slideshow.
yeah. No.
Oh, does it not? All right, hopefully, did these get sent out after the fact? I can go back to this one to just, here's the 9 goals that we'll walk through. And so back to goal 1, here are a few data sources where you can find the rates like tobacco smoking rates and vaping rates. And then there's also a kids survey that has kids data as well. And then here are some ideas of ways that you can get involved if tobacco cessation and research around that is what you're interested in. So we do have a lung cancer task force. We actually were just down in Pueblo, Colorado with an inflatable lung and the White Ribbon Project and a few other partners I'll go into later. But we were really spreading the word in Pueblo at the state fair around tobacco control and also around lung cancer screening. You can also refer survivors to the quit line. And then making sure that, places know about the ask, advise, refer, or ask, advise, assess, assist, and arrange to really get patients to quit. And then as some of you might know too, there's often a stigma around a lung cancer diagnosis. So really helping with campaigns to decrease that stigma. The White Ribbon Project likes to say that anybody with lungs can get cancer. And so we've done a lot with the White Ribbon Project to help get the word out there that it shouldn't be a stigmatizing diagnosis when you have a lung cancer diagnosis. So with the Lung Cancer Task Force, we have radiologists, pulmonologists, nonprofits, different health systems, where the coalition is that neutral playing ground where multiple health systems can come together to share best practices. Different clinics and federally qualified health centers, local and state public health associations, academia and research, industry, survivors and caregivers, and other physician champions. And I see a lung cancer task force member in here right now. So anybody, if you're interested in decreasing lung cancer in the state, that's the task force for you. So moving on is goal 2, which is increased prevalence of healthy behaviors. And this one really talks about all the healthy eating and active living activities. So decreasing overweight and obesity, and decreasing the amount of adults that drink excessively, and then also decreasing exposure to UV radiation. Similar data sources where you can find information on Coloradans who drink alcohol and their nutrition, how much fruits and veggies they're eating, how much exercise they're getting, how often they wear sunscreen or if they've had bad sunburns, and their weight status. And then with this one, there's lots of things we can do, like outreach events. The Sun Bus was actually at that event where I was just talking about. the lung cancer, inflatable lung. You can do employer outreach to any employers you work with to make sure they're instituting that healthy eating and active living for all of their employees. You can schedule the sun, but hopefully most of you have heard of the sun bus. Schedule the sun bus for different events, and we can collaborate on educational sessions on healthy eating, active living, and survivorship. So again, with this one, we don't have a task force that focuses specifically on healthy eating, active living. It's kind of sprinkled in through all of them, but we are always looking for that expertise. So if this is your area, you're welcome to become a coalition member and help provide that subject matter expertise and research angle from that avenue. We do have a skin cancer task force, and so we do work a lot with them to do outreach events out in the community. Goal 3 is increased uptake of clinical interventions to prevent cancer. And so this one talks about trying to increase the use of family history tools to collect that family history, also increasing HPV and the Hep B vaccine, and decreasing chronic cases of Hep C. So this one, there's one data source, and there's definitely more out there, but these are the ones we go to. So for this goal, we do have an HPV vaccination task force. One of our co-chairs, former co-chairs, is actually in the audience as well. And these task forces are just a great way to network within your disease state, partnership building, relationship building. They're also a great way for speaking opportunities. So if you want to share your research and have those speaking opportunities, that's another angle. And referral opportunities for research. So each task force has a distribution list. And so if you have studies and you're recruiting, they're great avenues to send out research opportunities. Some other goals we're working on related to this is growing the genetic counseling workforce. And we could also look at collaborating on educational opportunities around cancer family history and helping, especially in rural and frontier, helping those clinics with their clinic quality improvement and workflows to really ensure they're asking for that family history, and also doing motivational interviewing for the HPV vaccine and other vaccines to ensure people are up to date. So with this goal, we do have an HPV task force. It actually has dental professionals as well as other immunization professionals. And like my other task forces, it pulls from people from nonprofits, clinics. It's a pretty diverse audience on each task force, coming from a lot of different professions so that we can have a well-rounded task force to do the best work. This is one of my favorite examples of the coalition of partners coming to the table with different resources to help implement the cancer plan. So pre-COVID, a few years ago, we, through 3 different partners, we bought the rights to the Someone You Love documentary. The health department bought the documentary, the coalition paid for travel, and then Denver Health provided experts for motivational interviewing. So we picked 6 different communities and we showed the documentary. We had a Q&A panel after to talk more about the HPV vaccine and cervical cancer. And then the next day we went into the clinic setting and Denver Health did motivational interviewing to try to help them increase their HPV HPV vaccine uptake. And so that's just one of my favorite ones to share, of 3 different partners leveraging their resources to help make an impact in these 6 different communities outside of the metro area. So moving on to goal 4. This is decreasing environmental exposures that lead to cancer. So increasing knowledge and community on infrastructure around radon, increasing testing of household drinking water wells, and decreasing exposure to asbestos and diesel exhaust. There is on the Colorado Department of Public Health and Environment website, there is environmental data that you can find there to look at radon, private well water, and other occupational health hazards. So here are some ideas here. So we don't have an environmental task force. I would say the closest for this would be the joining the lung task force and working on the radon work group. And when it comes time to the cancer plan is rewritten every 5 years. And so we're always looking for environmental experts at that time as well to help revisit the cancer plan and help us prioritize what's in there around environmental exposures. And then lastly, definitely just encouraging everyone to get their home tested for radon and putting radon mitigation in if necessary. So for this one, who can help? Environmental professionals, radon professionals, and then all the different expertise that we have on the lung cancer task force as well. So moving on in the continuum, so from the prevention and moving on to the early detection and screening side, this one is all about different screenable cancers and then other cancer types as well. So goal 5.1 is around cancer screening in the average risk population. Goal 5.2 is around cancer screening in the other priority populations that might not have as readily available access to cancer screening. And then the third one is about non-screenable cancers. So the Behavioral Risk Factors and Surveillance Survey has data around some screenable cancers, and Vision has that as well. So what can we do together? We have so many different task forces that touch on different body parts. We also have a navigation task force that spans all cancer types. So you can join one of those task forces to help build authentic partnerships and referral networks. We're trying to bring back the breast cancer task force. We have a colorectal task force. We just last year started the Grupo de Cáncer en Español that's really helping us get out into the Latino community and help us figure out, what do we need to translate. We've been providing interpretation and translation for our partner meetings so that they can come to the table equally and participate in the coalition. We also have the lung cancer task force, the skin cancer task force, and the HPV vaccination task force. And I work with a lot of different people from the university on joint educational opportunities. We work with the Colorado Cancer Screening Program to help reduce structural barriers to cancer screening. Overall, we want to help improve referral networks and workflows so that people are being as efficient as possible and getting patients the care they need when they need it. And then lastly, I have on here, support research studies, including randomized control trials to investigate new and innovative cancer screening tests, which is a strategy pulled straight from the cancer plan. So with the lung and the colorectal, again, it's kind of a similar makeup. We've got physician champions, nonprofits, academia and research. We do have industry that comes to the table sometimes as well. And then that survivor and caregiver voice is always really important to make sure that we have them top of mind. This is hot off the press. So we just went down to the state fair for the first weekend. We put on a cancer spectacle, and you can sort of see right here, this is an inflatable lung. It had a virtual reality experience. This is an inflatable colon, and 9 Health was passing out fit kits that we'll follow up on. We had a lot of information on different cancer prevention and cancer support materials. Centura had a table. This is the Denver Health. They were doing breast education. The Sun Bus is hidden back here. They definitely found a few basal cell and squamous cell and possibly 2 melanomas. We're not exactly sure yet. But so it was super impactful to have them there for that community event. And, we didn't just want to go and spread the word about cancer awareness. And so we collected information from as many people as we could so that we can follow up and get them connected to lung cancer screening if they're eligible, follow up on the fit kits, also just get them connected to further colorectal cancer screening, breast cancer screening. So we have their zip codes, and we're going to follow up to try to get them for those screenings in their local community. And how this one came to be, this map isn't showing it specifically, but if you were to look at lung cancer incidence rates and mortality rates in this little corridor right here, it's pretty high compared to the rest of the state. And so we Once we got the inflatable lung confirmed, we kind of built the rest of the spectacle around that to really just try to draw people in and start that conversation. So more impact stories to come from this one, but there were a lot of different partners that came to the table to make this event happen. And the Lieutenant Governor did stop by for a visit, so we had to get a picture with her. This is some small media that we've been doing. So every thing that we try to do is evidence-based. And so this has been some small media campaigns during some of the different Cancer Awareness Month that drive them back to a map on our website to try and find a cancer screening location near them. So moving on to goal 6. So this is trying to make sure that no matter where you live, you're getting quality care, quality and timely care, so that you can have the best outcomes. Oops. So this one, 6.1, focuses on shared decision-making and helping patients be empowered patients and make their best decisions for themselves. Also reducing financial barriers, reducing geographic barriers, and improving testing and access to proving and emerging therapies. So this one, we're actually still in process of finding data sources. There is some data available from the Colorado Cancer Registry, but we are still actively looking for data resources for this. So if you know of any, please come up after or share in the Q&A session. We have recently started a clinical trials and treatment task force, and it's really exciting. So the coalition has almost been around 30 years, and to my knowledge, I don't think it has had a specific task force that focused on treatment and clinical trials. Some of the other, body part specific ones might have done some treatment stuff along the way, but it's great to have a focused on this emerging treatments and access to clinical trials so that we can really get, again, patients the best care in a timely manner. We are working on educating communities around clinical trials and how to access those. We have a survey out about biomarker utilization. It's generally covered in Colorado, but the uptake of biomarker testing is not as high as it should be with how it's covered. So we're really trying to dig into that. Other things that we could do together, education and promotion of informed decision-making, research and promotion of biomarker testing. I know this is already happening here, research on financial toxicity of a cancer diagnosis, and just overall helping reduce those barriers to care. So with this one, we do have that navigation task force. And so we have navigators, community health workers, promotoras, again, and the usual suspects from all the other different kinds of task forces as well. So goal 7 is increasing participation in high quality clinical trials. Again, for this one, we are looking for some data sources here to help inform this work and help us really prioritize where we as a coalition should be focusing our efforts. So with this one, again, you can join the Clinical Trials and Treatment Task Force. You can help with education around clinical trials. Again, promoting that informed decision-making. So, decreasing stigma around clinical trials and just letting them know how to access this and what it is. Reducing those structural barriers to care again. And then again, referral networks across systems to optimize patient outcomes. So that one is treatment@coloradocancercoalition.org. All right, moving on to survivorship. So survivorship is a big one. It's only one goal in here, but each objective is pretty large. So we have 8.1 focuses on that physical well-being, making sure they're getting exercise. Goal 8.2 talks about the mental, emotional, and behavioral health, getting the social support and social connectedness that they need. Improving transitions is, moving them through, once they're done with treatment, what does that look like? How do they go back to their PCP? How does the PCP know what long-term effects to look for and things like that? as well as that chapter also talks about palliative care and hospice. And then also again, talking about financial toxicity. So this is another one where we're constantly looking for data sources. We are able to look at the behavioral risk factors and surveillance survey and cross-tab the data if they say they're a cancer survivor, and then we can start to look at their physical activity and things like that. But we do definitely need some additional data sources here around survivorship metrics in Colorado. So there's lots of different ways that you can help improve the lives of cancer survivors here. We do have a survivorship and palliative care task force. We have a list of support groups, mostly in the metro area on our website. I'd love to build this out if we know of more support groups outside of the metro area. We also have, with a collaboration with the university, we had all of these resources in a kind of icon database. And so they took all of our resources and put it on this more visual map so that you could see what resources are close to you and just make it a little bit more useful for people as they were coming to find resources. You can encourage physical activity. Ray of Hope has a mental health support program, so patients can access that and see a counselor. As I was mentioning about the data sources, more research on survivorship, palliative care, and advanced directives. We could look at joint education on survivorship, palliative care, and advanced directives. And then just, more research so that we can then find partners to help create programs to meet the needs of cancer survivors. So with the survivorship task force, we have social workers, financial counselors, navigators, palliative care professionals, hospice professionals, and then again, all the other usual suspects as well. This is another, I already talked a little bit about the map, but I just wanted to show how it's helping implement the cancer plan. So we have a goal in there for providing a mechanism for identifying, promoting Colorado-specific resources such as a directory. So now we have the map, and we also have a AI chatbot. Right now, it focuses mostly on cancer screening messaging and where to find a cancer screening location near you. It has a little bit on the social support side and a little bit on financial toxicity. It will eventually have all of the resources that are on this map through the chatbot so that we know there's not enough navigators in the state. So if someone happens to land on our website looking for resources, hopefully the chatbot can navigate them to the resources they're looking for. And then ultimately, if it doesn't, we would then get them connected to a person who would then handhold them to a navigator or a social worker or a financial counselor, depending on what they were looking for. This is another example of some of the awareness that we've done around Healthcare Decisions Day and World Cancer Day. This is a representative in the House of Representatives member here. And so he got behind our campaign to help spread the word on World Cancer Day. And then we also worked with a few partners on Healthcare Decisions Day to really just encourage people to start those conversations about their advanced directives and things like that. All right, so lastly is goal 9, and this is the one that spans across the continuum. And this really looks at the navigator workforce, then also getting people connected to insurance, and then as well as being an empowered patient and patient-centered decision-making. Again, this is one where we are actively looking for data sources. It did look like Healthy People 2030 is also looking into evidence-based interventions around health literacy. So again, if you have data sources for this, I'd love to chat. Here are some ways that you can work together with us on this one. Participate in the navigation task force, promote informed decision-making, recruit more people to all oncology workforces. It's great to see you all here and all of you joining online. Share the AI chatbot with patients and caregivers. And then we are working on putting a navigator referral database together so that at least navigators can communicate with each other easily when they need to send a patient to a different location. So that one's navigation at coloradocancercoalition.org. And then I just want to share a few more things. So Evelyn mentioned this. We've been working with the Office of Community Outreach and Engagement to put together some regional cancer networks so that we can, again, build those authentic partnerships so that as you have evidence-based interventions and as you have research studies, we already have connections on the ground in the region that you could easily reach out to say, hey, we have this study going on, you know, who's the right partner here for that? So we have the Southwest region currently going. We have the kind of Northwest region going. We have the San Luis Valley. We have Southeast, and we have Eastern. And they're all at the stage. It's just been really encouraging to get them off the ground. It's already saving the people that have come to the network meetings. They're already, I can see their wheels spinning, and I can see that they're saving time by making these connections. One example I think it was a clinic in Gunnison, the social worker there needed some Medicaid resources, and they were like, I was spending hours on Google trying to find all the answers. And I was like, okay, wait, please stop. Let me just connect you to this one person here who probably has all the answers. And through that network, we were able to get them connected and just overall improve the efficiency of their workflow. And so those, just the convening of those groups has already been really beneficial. And as they select the EBIs they want to work on, we'll have even more impact to share from those regional cancer networks. So just to reiterate that point, through those task forces and through the networks, with the networking and education opportunities, with the best practice sharing, the partnership building, the speaking opportunities, the referral opportunities for patients, the increased efficiencies for employees, and through the collaborative programs and hearing of different funding opportunities that you may not have found, it overall will just lead to improved outcome for patients and hopefully, finding more cancers earlier so they can have better outcomes that way as well. So they're just really powerful, neutral playing grounds where you all can come together and do a lot of good. I mentioned this earlier. These are all the different task forces that we have. They all have action plans related to the cancer plan. And so when you're a member, you get to help prioritize, like, what is the biggest need when it comes to clinical trials and treatment? What is the biggest need when it comes to colorectal cancer? And then that's what they work on and then go through further strategic planning as time goes on. So in 2021, we had about a little over 180 active different task force members, over 750 people engaged with the coalition. And we do have a pretty extensive distribution list as well, all across the state. So again, it's just a great way to disseminate the research findings, research opportunities. We have a symposium coming up, actually. We have a symposium coming up, which would be a great speaking opportunity as well. So I'll go back to this. So how do we work together to prevent cancer, find it earlier, treat it better, and improve the quality of life for survivors? And that's really by all of you coming to the table to find the task force that's the right fit for you. Or if there's a regional cancer network where you're wanting to focus some of your research, maybe that's the right fit too. I'm always happy to have conversations about your interests and what you're looking for, and then helping you plug into the right task force that way. We could do joint educational events, networking events, outreach events. We can educate policymakers. I came from a meeting with a representative this morning. We could do collaborative programming. Again, you all, helping grow the oncology workforces. So getting more people interested in these fields. And then overall helping reduce those structural barriers to care. So again, no matter where you live or who you are getting the best access to treatment. So other ways to get involved, we do have a newsletter that we send on a monthly basis. I've mentioned the task forces and some speaking opportunities there. The possibilities are really endless. If you have energy and an idea and it is related to the cancer plan, you know, we are open to exploring those and trying to figure out how we can do those together. We do have some upcoming events. We have our annual symposium November 3rd and 4th. It'll be in Lakewood, Colorado, and on Zoom. We host a peer sharing session on the third Wednesday of every month. That is normally a 10 to 15 minute case study and then some facilitated Q&A. We have quarterly cancer partner meetings. We actually don't have any more for this year, but we'll have January, April, and July in 2023. And again, you know, feel free to shoot me an email and we can set up a time to just chat for 15 minutes and figure out what the best fit is for you. I like to close with this. So alone we can do so little, but together we can do so much. And my coalition is only as strong as all of the members and everybody coming to the table to bring their energy and ideas and their effort. And so I just want to thank you all for coming today and thank you for those online. I will open it up now for questions and then hope to see you all at some future task force meetings as time goes on. Evelyn, did any come through online?
I don't see any questions, just a request to type those questions, but I don't know if Adela was going to facilitate questions there in the audience. I do, or maybe Jamie, I do have some to get us started, but I'll let the audience or those online to type questions.
Hi, Evelyn. This is Jamie. I agreed to take over for Adela to run the Q&A session. So I'm going to go ahead and start. My name is Jamie Suits. I'm with the Cancer Prevention Control Program here at the Cancer Center, and I really appreciate your being here, Christy, and sharing the important work of the Cancer Coalition and the structure that the Cancer Plan provides for all of our work. I'm going to start off with a really tough question because many of our colleagues and students and faculty here and on this seminar series are basic scientists. Why is it important for basic scientists to bridge to the Cancer Coalition as well as the understanding the Colorado Cancer Plan, and then finally, what is the benefit to them for doing so?
Thanks, Jamie. So from my perspective, I think at first, it'll help make the science better by giving them those relationships to the people who are on the ground, seeing patients, trying to prevent cancer and things like that. So it just gives them different networking connections, help improve their science, maybe even increase their longevity in the role because they have this peer support through the task force of other people doing similar work. I would love your perspective on that answer from the lung cancer angle.
Happy to provide some. I mean, I think we're all living in the age of clinical and translational science where it's less acceptable for us to be in our labs and not considering the broader context of the work that we're doing and connecting to meaningful changes, whether that be introducing new agents into care or other ways. And I think that engaging the coalition and engaging and understanding the cancer plan can bring additional layers of meaning to your work. To understand what the burden of cancer is in Colorado and how your work every day in the lab can connect with that. And I think it's also a unique opportunity to get out in the community, share your passions, and so that we can communicate a better understanding of cancer research and its importance to the community, because ultimately, without the community's support and without society's support, we continue to kind of undermine the value of what we do in our science. And you can see that in terms of decision making at a higher level, at a political level, that sort of eroded some of the confidence in what we do. But that would be how I would additionally add on to that. Any other comments, both whether they come in online or questions from attendees here?
We don't have any online. I did want to ask Christy if there are no other questions. If you can expand just for our Cancer Center members who are attending, how the Cancer Center has supported some of the initiatives, for example, at the event in Pueblo.
Yes, yeah. So the Cancer Center has been an amazing partner for my whole tenure with the coalition. The Office of Community Outreach and Engagement helped with the goodie bag procurement, and they also came out every day and helped staff the table and helped just overall with the awareness of the cancer spectacle. And then also with the regional cancer networks, the coalition's been working really closely with the COE office on getting those regional cancer networks off the ground, and helping then with the evidence-based intervention in each of those communities as well. And for most of our annual symposiums, we've had a few speakers coming from the Cancer Center, and let's see what else. Some of our other educational events, I definitely pull in speakers from the university. So yeah, it's been a great partner, and I look forward to finding just even new ways that we can partner and collaborate to, again, improve those outcomes here in Colorado.
And the Cancer Center has also been a sponsor of the activities, correct?
Yep.
So financially, we have supported some of the activities.
Yes, thank you.
So there are a lot of ways in which the Cancer Center is a partner, but we really would like more engagement from our Cancer Center members, whether it is through basic science, like Jamie was mentioning, but also perhaps, volunteering for some of the task forces, given the expertise, the great expertise that we have among our Cancer Center members. Students as well, trainees.
Yep. Yeah. Thank you, Evelyn.
So I have a question for our attendees, but first a little bit of background information. So you may all be aware that as part of the Colorado Cancer Center, we're all sort of governed by what's called the Cancer Center Support Grant, and that is from the NCI. It's sort of our good housekeeping seal of approval that we are one of the top cancer centers in the country. And alongside of that, they push out some initiatives of what is important for our science. And one of the most important initiatives that they have is a recognition of community outreach and engagement. The office that Dr. Barrio leads and has several staff members. And one of the biggest challenges is actually engaging the basic scientists in community outreach and engagement. And that is a vital part of how the Cancer Center will be evaluated going forward. And working with the Cancer Coalition and the Colorado Cancer Plan and allocating your time, energy, and effort to that is going to be one of the things that the basis of which we are evaluated as a cancer center, and how we are connecting and supporting and changing cancer in our community for the better. And so with that background, I want to ask if anybody in here has worked with the Colorado Cancer Coalition or with community outreach and engagement, and whether you'd be willing to share any of your experiences about that.
Can we call you out, Kate?
Well, I previously worked from a different public health task force, and through that task force, we did a lot of educational events, getting people education around getting vaccine, and also coordinating some motivational to help understand how to talk to somebody. So a little bit of different context is where
Okay. I'll just go ahead and summarize that a little bit for the folks online who can hear. One of our participants talked about her role in public health and in doing outreach to primary care clinicians and other individuals with regard to the HPV vaccine and creating it opportunities to expand its penetration into our society and try to boost those rates by helping clinicians understand the importance of it and how to talk with their patients and the parents of patients about this and very important cancer prevention tool that we have that it was their tax dollars that went into funding the science that ultimately made that vaccine available. And so how do we return that investment back to society? And that is getting, more folks vaccinated, understanding and access to this opportunity. So I editorialized a little bit on your comment, but I think it's a great example of how science and community really need to connect. And we have to shorten the bridge between our lab space and our community. At least that's what the NCI is telling us and what the NCI is invested in terms of, improving the impact of our science on communities and overall showing a reduction in cancer burden across the country.
And somebody put something on the chat to answer your question, and that was Tamara Terzian. This is the faculty from the UC, faculty from UC that work with the Sunbus have collaborated with you. Maybe you can expand more. That's all that the comment says.
Yeah. So the Sunbus has also been a great collaborator. Last year, we helped them go out to Cheyenne Wells, which is about as far east as you can go before you hit Kansas. And we went to their county fair and actually saw behavior change on the spot with the Sunbus. They have the reveal imager that shows the sun damage on your face, and people were seeing that sun damage and they were buying sunscreen, buying hats, buying the SPF clothing so that they could take care of themselves. And then they were also part of the spectacle as well. They had some dermatologists there for 2 of the 3 days and were checking people's skin. This is especially in Colorado where there's a lot of rural and frontier communities with a lot of agricultural workers. Like, we really need to find ways to get the Sunbus out into those communities. And so hopefully my Skin Cancer Task Force will be working along with them on that. But yes, they've been a great partner getting out into the community.
Okay, last chance for any comments or questions. There's a couple of you out there in the audience who are sending me signals that they like, maybe I have a comment or a question, but you're not willing to say anything yet. So here's your last chance. Evelyn, do you see anything else online?
No, they're not online, just a comment about the Sunbus, but you just addressed that, Christy.
I'll just put in one small last plug. I'm actually a clinical psychologist by training, but I don't see patients anymore provide direct care. But the opportunity for me personally to be out in the community engaged has become my patient. It really has supplanted that need to have a direct impact. And so when it really is a unique opportunity to get outside the lab and to go and interact with people and see the impact that you can have on community outcomes. It's as rewarding as you can get, and strongly encourage you to consider this, adding it to your portfolio of what you're doing to change cancer, Colorado and nationally. Christy, thank you very much for your time and commitment overall to reducing the burden of cancer in Colorado. I have a great time working with you and hope for many years to come. Thanks.
Thank you, everyone. Just email me and we can chat and I can plug you into the right task force.
Well, thank you very much, Christy. We really appreciate your partnership, and the presentation was great. So thank you.
Thank you, Evelyn.